Welcome to Amintro Family, the podcast, brought to you by Chartwell Retirement Residences. I'm your host, Jeff Sammut. We hope you're enjoying the free online platform and community for family caregivers, be it through the Amintro Family app or amintrofamily.com, because it's all about helping those caring for their aging parents and relatives or friends and to connect and share experiences and access valuable resources. Our guest today is a clinical psychologist, family therapist, healthcare consultant, speaker, and author of books for caregivers that include The Emotional Survival Guide for Caregivers and the AARP Caregiver Answer Book. He's also written a caregiver self-help column for AARP.org since 2013. We're very fortunate to have Dr. Barry J. Jacobs join us on the show. Barry, it's great to have you.
Thanks so much, Jeff. Really my pleasure to be here with you.
Really appreciate it. Now, your work has become nationally recognized, but first, I'd like to delve into your personal experience with caregiving. Your mother had vascular dementia and your stepfather had Alzheimer's. You were a primary caregiver yourself for about 7 years, weren't you?
I was. That occurred during my 50s. Actually, even prior to that, my wife and I cared for my father-in-law, who had also had vascular dementia for about a year and a half. So we had about a 9-year stretch of caregiving for our aging parents. I had already written a book about caregiving prior to that, been a psychologist for a long time treating family caregivers. But I have to tell you that 9-year stretch really informed me in a very personal way about caregiving and has made a big difference in my work since then.
Yeah, I would think so. And many who are caregiving, as you know, Barry, they're like turtles on their backs. I've been there, right? And, we're trying to help here on the show through community and dialogue all together with Amintro. Did you have all the answers as a caregiver? Did your professional background give you a leg up on knowing how to care for your mother and stepfather and your father-in-law and getting ahead instead of falling behind?
It helped in some ways. It may have hindered me in others. So it helped in that I understood the way the healthcare system works. I understood I knew something about medications. I had worked for almost 30 years in as a psychologist working in medical systems. And so I could navigate through, and I understood some of the issues at hand. It hindered me in that in some ways I thought I knew more than I knew. And so that I really had to learn the blind spots that I had, things about finances, things about dealing with insurance that I was really clueless about, and then went through the kind of education that most caregivers go through in really getting in deep with caregiving.
So I guess with all that you just mentioned there, because you mentioned earlier that it's made you a better professional and better understanding what caregiving was all about, having gone through it yourself. Would those have been the holes that you would have filled in professionally?
Absolutely, and I would also say, my mom in particular was somebody who was very resistant to care, and a very proud woman, had really accomplished a lot in her life. When it came toward the end of her life, and she was physically and cognitively diminished, it was very hard for her to receive care, even from me, her oldest son. But so I had to learn to be more compassionate to her. I was often not as patient as I would have liked to have been in providing care for her. I sort of knew what needed to get done, but that just knowing that didn't mean that my mother was ready to accept it. And so I had to slow down a bit, and that took me a little while to learn.
Well, a lack of patience, I think a lot of caregivers would look back retrospectively and say, geez, I wish I had been more patient. Do you find that? And I'm going to ask you about recurring themes that you would have heard from caregivers that you speak with, but would that have been a recurring theme? Talking about how I wish I'd been more patient when I look back.
I think that every day. My mom is died about 9 years ago now, and my stepfather almost 12 years ago. But I think that every day. I have self-recrimination about not having been as patient as I could have been and should have been. The other thing is I needed to be focused less on the tasks and more on the relationship. It's something I talk a lot about with caregivers now. When in retrospect, it's not all the things that you got done that you remember. It's not all the times you took someone to a doctor's appointment or picked up their medicines or helped them get dressed in the morning. All that stuff is very important on the day-to-day, but the big picture is, was I able to help them live as well as I could with the disabilities that they had and maintain the loving connection with them? A typical example with my mom would be we would have an 11 o'clock doctor's appointment. I would stop at her appointment, stop at her apartment, excuse me, around 10 o'clock to pick her up and take her to that appointment, and she wouldn't be ready. And I would be very impatient. I'd be trying to push her along, trying to make sure she got dressed, make sure she ate, and we would invariably be late for the appointment. And sometimes we didn't make it there at all, and it just drove me crazy because I had taken off of work to get that done. But for my mom, she was doing the best that she could, and I just needed to slow down to her pace and be more patient with her.
I'm sure you were doing the best you could as well. You're juggling. Caregivers are always juggling. But did you get to a point in caregiving for your folks that you could remove yourself as being the primary caregiver in terms of the day-to-day? Like, were they relocated to long-term care facilities so that some of the day-to-day could be taken care of, and then you could just go and spend time with them?
Yes, the answer to that is yes, and that didn't happen right away. There was about several years where they were living in an apartment about a mile from my home here in Pennsylvania, but both of them, because of their dementia, wound up in skilled nursing facilities at various points. And yes, as you point out, I didn't have to do the day-to-day care. I didn't have to rush them. I could just show up as a son, as a stepson, and care for them. The caregiving didn't stop at that point. I was still going. I would be bringing lunch. I'd be providing, just providing company, providing stories. I'd be talking with the staff there to make sure that the care that they were receiving was exactly as they would have liked. So I was their advocate. But as you point out, I didn't have to do some of the hard nitty-gritty work of caregiving that I had been doing previously.
Mm. Were you at any point caregiving for the both of them at the same time?
Yeah, so my mother and stepfather were living in Florida for years, and my stepfather had developed Alzheimer's dementia. My mother was his primary caregiver, and my mother was herself becoming very frail and, to my mind, beginning to slip a little bit cognitively. And so my wife and I moved the two of them up from Florida to live very close to us so that, at least initially, I could support my mom with caring for my stepfather. I got very involved in caring for my stepfather, whose dementia was quite advanced at that point. But in so doing, I began to see that my mother wasn't able to handle lots of tasks, not just my stepfather's agitated behavior at times, but wasn't able to handle her finances, wasn't able to make decisions. And so my wife and I became very involved in both of their lives. That's not exactly what my mother had in mind. My mother wanted us to support her in caring for him, but she needed the help as well, and that became more apparent over time.
The relocation, what went into that idea? Was that a last resort? Was there any possibility that they could have stayed in Florida? What had you all arrived to that decision?
There were a number of factors. I mean, certainly my mother was physically frail, and she just couldn't do all the care tasks for my stepfather that he needed. The other big issue was money. They had essentially run out of money. They couldn't afford where they were living any longer. One of the first things I had to do was hire a bankruptcy attorney and help them declare bankruptcy because it had gotten that bad. And so they needed a place to live other than where they were living. We discussed the possibility of them moving into a less expensive place in Florida, but it really didn't make sense. So instead, we moved them to an apartment that we purchased for them near us, and then became very involved in their lives.
So I want to know more. You talk about being the oldest sibling. What kind of team did you and your wife have? Because that's often something we talk about here on the show is, as a primary caregiver, you got to learn that you are the captain of a team and that your team is going to grow as the care receiver's illness worsens. You just need more help and you need to have more people. What was your team like?
My team was small but mighty. My co-captain, I call her such, was my wife. I mean, she went through this every step of the way with me. At that time we had 2 teenage children, and they were helpful in providing companionship for my mother and stepfather. We had professionals like home health aides that came in and helped support them. My brother lives some distance away, almost 500 miles away. He could help on an occasional basis, but because he wasn't involved in the day to day, he didn't always understand what was going on. He didn't understand their needs. He didn't understand the systems of care as I understood them. So I would say at least initially, he was of limited help. But and then I had my mother's nieces, my cousins, who also lived at some distance, but would come and visit her. And so it was some family, some professional help, but primarily my wife and I were doing the bulk of the work.
Let's delve more into your expertise versus your experience, or maybe they go hand in hand. Most, Barry, if not all, of the caregivers that I've spoken to on the show have had relatively good experiences for the most part in partnering with their siblings, caring for their aging parents. And I would honestly say, on my end, I didn't get to bat 1,000 in that area. So maybe this is a subject matter that I tend to gravitate to when given the opportunity. How does a caregiver best deal with siblings, especially those who might want to take over, or on the flip side, not help at all?
So in my work as a psychologist, this comes up very frequently and often with a lot of emotion. This is one of the things that most bothers caregivers of aging parents when, as you say, their siblings either try to take over or throw up their hands and say it's on you. And initially, my brother said to me, "It's on you." He didn't want to be involved, and I was quite resentful of that. And it led to a bit of a standoff between he and I that went on for some time. He to his credit, over time, he kind of came through more, and our relationship has since recovered. But I would say our relationship initially was damaged. So I've written a lot about this in various places during my career, including there's a chapter on this in the AARP Caregiver Answer book. But I talk a lot with how siblings can develop consensus about what the needs of the parents are, and then develop a plan to meet those needs. And with the understanding that it's not going to be equal and fair all the time, but that if each sibling really needs to step up and do something, there needs to be some contribution, and that without that contribution, when a sibling says, "No, I'm not going to work, I'm not going to do this because I have work responsibilities," that just undermines the relationship. And so I will put that very squarely to people. It's not just about getting the caregiving done. It's about how do you either strengthen or weaken your relationship as siblings long after your parents have died. And because it matters a lot. I mean, people always remember who was there in mom's hour of need, who was there in my hour of need as a primary caregiver. If you were not there for me, then I'm not going to have the same respect for you in the future. And so I really put that to them very frankly, and let them know that everybody is observing what everyone else is doing, and judging it as such.
At a certain point, though, do you have to just let it go and say, look, they're going to do what they're going to do. I just don't have the energy or the bandwidth to be upset about what they're doing or not doing. At some point, do you have to arrive at that?
I mean, that sounds good. I mean, in theory,
yeah,
I think in practice,
easier said than done. Yeah,
for sure. I mean, I think what happens is that the people stop asking after a while. They don't want to have their requests rejected again, so they stop asking. But that doesn't mean that they stop feeling something about it. They may be resigned to it, but again, it will undermine that relationship, or if not totally undermine it, will weaken it over time. You know, the classic example is the sisters in a sibling group will be doing the caregiving, and the brothers will say, "No, it's up to you. You're the sisters. You're supposed to do this. We have to focus on our careers." And those sisters resent those brothers, and they may decide that they're going to forgive them, but it doesn't always come easy. And the brothers who understand what the sisters are going through have some compassion and actually decide that they may set their careers aside for a little while and help. That they're appreciated so greatly, and it improves their relationship with their sisters over time, and it gives them as siblings the opportunity to really get to know one another in ways that they maybe never have as adults. What happens oftentimes is, people move away from home. They have childhood relationship with their siblings. After that, they see them a few times a year. But they don't ever have the experience of working together as adults. Caregiving brings them together as adults. They learn about their strengths and talents. They learn more about their personalities. They stop seeing them in the way they saw them as kids. And so if the brothers don't do that, they miss out on a lot.
So we've talked about relationships with siblings while you're caregiving. We've talked about impatience as a caregiver, and I want to hear what you often hear the most from caregivers, because you've delivered more than 700 presentations to family caregivers and healthcare providers and social service professionals, care managers as well. You maintain your psychotherapy practice, specializing in supporting older adults with serious or chronic illnesses and their family caregivers. So what do you most often hear from caregivers about what they're going through?
I mean, what I most hear is this is extremely stressful, and people don't know the path forward, and so they're, particularly at the beginning, they feel very lost, and the combination of feeling lost and feeling very responsible is a bad combination. People begin to panic a little bit. There are a lot of resources out there to help people learn their way forward, but oftentimes people don't know what those resources are, and so there are governmental resources. There are plenty of websites. I do a lot of work for ARP that has a lot of very good articles and other guidance. And people have to trust that over time they're going to get better at this. They're going to learn the ropes. They're going to gain skills. They're going to know what to do. And after some time, they're going to have a sense of mastery about this. So this is a learning experience. So in answer to your question, Jeff, I mean, one of the main things that I see is at the end of caregiving, people think that, well, I'm just going to go back to the life that I had before. And in my experience, that almost never happens, because people are changed by caregiving. They've learned more, they've grown more, and they look at the world in a little different way. And sometimes it means that even if they go back to do the same work, raise the same family they did before, they're bringing a different type of intention, different type of mindset than they did previously. Or I've seen many people literally change their careers. They say, I this was very gratifying for me to be in a position of helping others. I want to be able to do this again. And sometimes they'll care for other family members. Sometimes they'll become hospice volunteers. Sometimes they'll literally become home health aides, because they found doing that hands-on work to be meaningful to them. So my hope is that for every caregiver at the end of the day, or it's able to say, this was hard, this was stressful, this was hard, but I'm glad that I did it, and I'm a better person for having done it, and I've grown a lot. And now I can bring a different sense of myself, a different contribution to the world that I could have previously.
Well, in that vein, you make me think of an old friend of mine, and unfortunately, I recently had to go to his mother's funeral, and he had we're the same age, and we're pushing 50, and he was his mother's caregiver for years, decades. He had to take care of his dad at a certain point while his mom was still around, and his mom was starting to be in failing health at that time. And then for decades, he took care of her, and he lived at home and chose to do so because he knew his mother needed the care. If he left, she'd have to relocate. So he stayed home to be with her. And then she passes away, and we're at his funeral, and I said to him something to the effect of, I hope, moving forward, you can take some time to take care of yourself. What do you say to somebody that's just gone through that is now in this new world of, I don't have to care for somebody right now. All of this time and energy that I had spent, I don't have to spend it on caregiving now. And it can be really tough for them to find their footing. What do you say to people in those situations?
I'm going to say to them that I think you're going to grieve the person who died, and you're going to grieve the role that you had, which was meaningful to you, and that you're basically in a new phase of your life, and transitioning to that phase is going to take a couple of years. So people often underestimate how long this transition takes. I'd say 1 to 2 years on average, and in that time, people are going to learn what is still meaningful to them, what kind of contribution they want to make. And they'll really come to reflect upon what values they practiced in their caregiving, and how can they practice those values again in other roles in the world.
Yeah. Yeah, and that's great advice, because when you can put a bit of a timeline on it, like say 1 to 2 years, give yourself that grace period, then maybe one that's listening right now that's in that situation could say, oh, I do have some time here. It's been a couple of months. Shouldn't I be at this point? Now it's good to hear that timeline.
Yeah, I think people sometimes judge themselves too
Yeah.
harshly. I mean, grace is exactly the right word. People need to understand that this is an extremely significant life change, and it's going to take a while to figure out who you are now. I mean, literally, it's a sense of developing a new identity. So I wish your friend a lot of luck with this. I think it's going to be a long process, but I'm hoping again that he can look back on what he did, the comfort he provided, the care that he gave lovingly, and feel good about it, and then understand that represents a core part of himself, and how does he bring that to the rest of his life.
At some point, I'm sure he would have felt caregiver burnout. We all do, as caregivers. What are the first signs, Barry, of caregiver burnout?
To me, the hallmark of caregiver burnout is waking up in the morning and feeling a sense of dread, like getting up and maybe not feeling rested because you didn't sleep well, but also feeling like, oh my Lord, I've got to do this again. I've got to get up and I've got to do, drive here, and I've got to pick this up, and I've got to go, do this hands-on caregiving. And that sense of sameness, that sense of drudgery, that sense of just feeling worn down, that's burnout.
Well, is there a fine line that needs to be walked by a caregiver in making sure that they are giving the care and the dignity to the care receiver that they deserve, while also not experiencing burnout themselves?
I mean, again, that's often easier said than done because people see what
Yeah.
someone needs. I think the key to this is, as a say an adult child, you have to realize that your job isn't to provide all the care yourself. Your job is to make sure that that your parent is doing well, because you've arranged for the right care to be provided for them. So there's a difference between feeling totally responsible for everything, which many caregivers who burn out feel, versus I'm going to delegate to this person or that person, or I'm going to hire someone if I have the financial means to do so. And I'm going to be more of as you pointed out, a captain of the team, or I'm going to be the CEO. I mean, different people use different analogies here, but I'm not going to do this all myself. And if I'm delegating to others, then I am able to carve out time for the kind of activities that replenish me, because as is implicit in what you were asking, caregiving does burn people out. It just is a lot of energy going out all the time. We've got to put that energy back in the system so we have something to give. And so if we delegate and then we have more time, then we can take those walks. We can drink that cup of coffee peacefully. We can go to the gym. We can see a friend. I mean, and without that regular self-care and that protected time for that, then we're much more at risk of just waking up with that terrible feeling of dread in the morning.
Oh, delegation is big. You're absolutely right. You're listening to Amintro Family, the podcast, brought to you by Chartwell Retirement Residences. I'm Jeff Sammut with clinical psychologist, family therapist, healthcare consultant, speaker, and author, Dr. Barry J. Jacobs. Do you find, Barry, that caregivers often worry about their own mortality, wondering what might happen to their loved ones if they weren't around anymore?
So what I often see is if you're caring for someone with dementia, there's always a fear that, am I going to get dementia one day? And how will I face this? Or if someone caring for someone with Parkinson's disease, same thing. So I think people put themselves in the shoes of the person they're caring for and thinking, is this my fate? It's just a matter of time. Do people think about their own death? I have not had that conversation very often. I have had conversations just about what is most meaningful in life. And there are people who thought that going out and having a good time was really what life was about, and then they get involved in caregiving and they see that there are things that are more meaningful to them, that making a difference, a positive difference in someone else's life, is about the most important thing that they can do. Having a good time then is a distant second to that, and so people make changes.
Well, we'll throw this as well under the category of easier said than done, but let's remind ourselves that this is achievable. How do caregivers best stay positive overall?
I think what I always point out to caregivers is we need to think about this as a forest and trees situation. So the trees are the daily and sometimes weekly caregiving tasks that people must do. And people get very wrapped up in those daily tasks because there's a lot to do. And, they wake up with a long list of things to do every day. But we have to keep in sight the forest, the greater purpose for why we're doing this. And that is to care for somebody to live as well as they can, even in a diminished capacity, because we care about them and we want them to live as well as possible. And the daily tasks really are very challenging and can wear us down. But if we can remain focused on the greater purpose, it will help sustain us, and we'll be able to have a greater sense of positive outlook as we go forward.
So what do you believe the future of caregiving support is going to look like, Barry? And will there be systemic changes to better support caregivers?
I mean, I think that the demographic changes that are at hand. I mean, I'm not going to say they're coming; they're at hand. I mean, the population, the age of the population is tilting towards older adults. I mean, we're going to in the not too distant future, we're going to have more people over 65 than we have people under 18 in many Western industrialized countries. So those demographic changes are already driving systemic changes. More money being given to say home and community-based supports. It's not happening as fast as it needs to happen, but it's also, I think, spurring a lot of technological innovation, a lot of entrepreneurship to create the home, the apartments of tomorrow with the remote monitoring, the environmental supports to help people live, age in place better. And so I think we're kind of slowly seeing the transformation of our culture, which is going to accelerate in the next 5 to 10 years as it becomes more evident that a lot of our societal resources go into caring for people who are aging.
Barry, I've got to ask you this on the way out. The AARP Caregiver Answer book, you wrote that with your wife, and it seemingly covers everything: preventing loved ones from falling, finding care, the emotional challenges that come with caregiving, and so on. What did it take to cover all the bases in writing that book?
It covered spending over 30 years meeting with clients, working in healthcare settings, as well as having my own family caregiving experiences, to realize all the different facets of this, and to realize that, and to hear all the many questions that caregivers have. And we heard the same questions again and again and again over many, many years. And so the book has almost 150 questions and answers that are to us is like an FAQ, a frequently asked questions, to really cover the basics, to help people get the lay of the land. It's not going to answer every question every caregiver has for their particular situation, but it's going to help them develop a framework to understand just the basics, and then to know what additional questions they'll need to ask of their physicians and other providers who are helping support them with their caregiving.
No, I'm so glad that you've written that book, and folks can visit caregiveranswerbook.com and aarp.org as well for your caregiver self-help column as well. Dr. Barry J. Jacobs, thrilled to have had you on the show, and I'm sure you've helped many of our listeners, Barry. Thank you so much for joining us.
Thank you, Jeff. My pleasure to be here.
I'm Jeff Sammut. This has been another episode of Amintro Family, the podcast, brought to you by Chartwell Retirement Residences. You can hear the show on the Amintro Family app and wherever you listen to podcasts. Check out amintrofamily.com. And a reminder, we want to hear your stories on the forum, and we can share them here as well on Amintro Family, the podcast.